Welcome to the 5 on 5. We're pleased to be joined by Dr. Adam Mougey, a gastroenterologist. Dr. Mougey, thanks so much for being here.
Oh yeah, thanks for having me.
We are here to talk about a new weight loss procedure that is less invasive. Talk to me a little bit about this.
Sure. So Gastroenterology Consultants is now offering a procedure called the Reshape Procedure, which is a endoscopically placed balloon. This is actually a 12-month procedure where a balloon is placed within patients' stomachs for about 6 months, and they follow with a health coach on a monthly basis. And the idea is that while they're losing weight because they have this balloon that's allowing them to feel more full, they're also actually starting to engage in more healthy habits. And essentially, it's a tool to help patients keep the weight off in the future.
What are some of the benefits to a procedure like this versus maybe something more traditional like gastric bypass?
Sure. Endoscopic balloon placement is almost like in the middle of the options that we have currently. Oftentimes people try and lose weight just typically with a diet. That's a difficult thing to do, or else of course there wouldn't be a lot of people who are overweight right now. Bariatric surgery is a very effective way for people to lose weight, but of course it involves some pretty significant anatomic changes, and there can be some side effects from that. And this is something that can be more of a temporary weight loss measure that doesn't require quite the same level of risk that a bariatric surgery might entail.
So if we're looking at this, it's a 12-month period. So after that 12 months, is the balloon removed?
Correct.
Okay, and so then all those healthy habits that you maybe developed over the year will stick with you, but you don't need the balloon there anymore?
Yeah, that's the idea, and people have typically been very successful so far as maintaining the weight loss once the balloon is removed.
Weight a problem in the country, in Oregon?
Absolutely. If you look at the general statistics for the United States, there's 60 to 70 million people who kind of meet the size criteria for this particular procedure, which is a BMI between 30 and 40. There's even a greater number than that who are more obese. And
when you're talking about overweight versus obese, what is the difference there?
There's actually a medical definition for overweight versus obese. So we often use this size criteria called a BMI, which involves your height and your weight. And of course, it's an estimation of whether you're really overweight or not. In general, a BMI between 25 and 30 is felt to be overweight, whereas a BMI of 30 or above is defined as being obese.
Okay. We got much more to talk about, including who would be a great candidate for this procedure, but we will take a quick break. We'll be right back. Welcome back. We're pleased to be joined again by Dr. Adam Mougey, a gastroenterologist. Dr. Mougey, thanks so much again for being here.
Of course. So
we're talking about a new procedure, a weight loss procedure that's called Reshape. Talk to me a little bit about who would be a good candidate for this kind of procedure.
Currently, the FDA has approved this therapy for patients who have a BMI between 30 and 40.
Okay. And it's obviously a less invasive surgery. You're talking about doing it I'll let you use the
endoscopically,
okay.
Correct.
Okay, which means less recovery time. Talk about kind of the difference in recovery time versus maybe another surgery that someone has heard of.
Sure. So, it's important to define that this surgery really is something for someone who is not morbidly obese. So again, a BMI of 40 or above really needs to be seen a bariatric surgeon, someone who can provide a little more weight loss than an endoscopic balloon can. That being said, this is significantly less invasive. It involves what's called conscious sedation. We don't use a tube down your throat or anything like that to help you breathe. And while you're asleep, we place the balloon endoscopically, meaning that there's no actual cutting that's required for this balloon to be placed.
Okay, and so this might be great for somebody who is nearing that BMI where you wouldn't be a candidate before you get to that point?
Yeah, absolutely.
Okay. Where can people get more information on this?
So there actually is a website that Reshape has, Reshape Ready. If you visit the Gastroenterology Consultants website, we also have a link to that can describe the procedure a little bit more in detail.
Okay. And one question I'm sure people might have at home, does insurance cover something like this?
Right now insurance doesn't cover anything like this, which is unfortunate. I think it's a wonderful tool. In general, this is about a third the cost of like a bariatric surgery, which is often sometimes also done more electively or without insurance coverage. So I think it's a good bridge and a useful tool.
Dr. Mougey, anything that I didn't touch on that you want to add while we've got you here?
No, I think you got all of it.
Well, we appreciate your time. Thanks so much for coming in.
Absolutely.
We'll be right back.